Good morning, everybody. Thanks for joining us. My name's David Farnes. I'm with the Canadian Advanced Technology Alliance, and this is TechNOW, the mobile health channel. Joining me today is Matthew Johnson, who's Senior Business Development Manager with the Ontario Centres of Excellence. And today we're going to be talking about the very interesting, very exciting Advancing Health program in its second year. Matthew, good morning, and thanks for joining us.
All right, thanks a lot, David.
So let's get on to this right away. Last year, you and I spoke about the program. You gave us a lot of information, and that's still available on the CATA website. Why don't you just give us a synopsis of the program and how successful it was last year?
Well, sure, thanks. So last year was the first year of the program. It was a new program for OCE, and it was a great success. We had a lot of interest from the healthcare provider sector, lots of interest from companies. It really is a unique opportunity for hospitals and companies to work together to demonstrate innovative health IT and mobile health technologies in the public system. So we went through that first year. Again, lots of interest, lots of expressions of interest. And we ended up with funding five fantastic projects that we're really proud of, and you should look for the announcement of those projects very shortly. And so now we're entering into the second year of the program, hoping to continue that momentum, continue to build interest in the program. This year is a little bit different. We're going to go, or we've decided to go with a theme of virtual care and patient engagement. And we arrived at this theme based on consultations with healthcare provider organizations as well. We're taking the lead of the OHIC report, the Ontario Health Innovation Council report, which recommended these kinds of technologies, virtual care and patient engagement technologies, as a priority for Ontario to assess in an evidence-based manner. So, we want to support that. Which is why we've chosen the theme, and we're going to go through the process again, and looking forward to it.
I love the program. I think it was the first one in Canada that I saw really trying to bring together partners from across the ecosystem, trying to marry up industry with healthcare professionals or health institutions, which is fantastic. I see the Canadian Institutes of Health Research EHIP program has borrowed from that, and they've got a big funding call underway right now. And I'm really excited to see that you're bringing year two to the table. I like the theme, and I think the theme dovetails nicely with Ontario's strategy for healthcare, extending care into the community. So, patient engagement and virtual care is so important, but they're still kind of broad themes. If you, is it intentionally broad? Do you have particular focuses? For example, CIHR, we're looking at mental health issues with youth and the aging population, like services for seniors. Have you got any?
Yeah, no, we haven't specified, an indication or any particular clinical area. Really, what we want to do is, listen to the healthcare providers and have them tell us what their problems are. We're kind of outside of the healthcare system. They're in it day to day. They know what their problems are better than us, and they know better where a solution could have real impact. So, we want to take their lead. We want them to tell us what their problems are, and then hopefully we can marry them with innovative solutions, and then provide some funding for them to try it out, to assess the impact of a market-ready Ontario technology to create value for the healthcare system. So. It's intentionally broad, absolutely, because we want people to get creative and think about what's possible.
Which I think that's wise to keep it intentionally broad. I mean, I think it's a good a good approach.
Mm-hmm.
Now, in terms of bringing people together, you're going to have a partnering forum. I'm just trying to look at my notes here to figure out when is that partnering
Yeah.
forum? It's in Toronto, coming up soon, I think.
It is. That's right. It is coming up soon. So the partnering forum will be on May 8th here in Toronto at the Design Exchange. That's on Bay Street. It's very close to Union Station, so it's convenient for people coming in from out of town. And that day will be about sharing stories. So healthcare providers, companies, academics, different stakeholders in the healthcare system and in the tech community. We want to give them this forum to share their stories, to explore avenues of collaboration. We're going to hear directly from healthcare providers. They're going to present to the audience their problem statements. So really, it's in support of this, the program being a pull program, a healthcare system pull program. And, we hope to have some fun with it, either create or develop collaborations that have the potential to apply for this funding. And I'll just remind everyone, the funding available from OCE is up to $350,000, which needs to be matched by the partners in cash and in kind, and that can support a project of up to 2 years. So it's quite generous. It's quite flexible. The funding can defer costs on either side of the partnership. So in the company or in the hospital or any other public healthcare provider partner, and it's purposefully flexible, so people can really think about how they can deploy a cool new technology to solve a critical problem in the healthcare system.
And are you looking for like one-on-one relationships in an industry partner with a healthcare partner, or can it be larger teams than that? What are you looking for?
It can absolutely be larger, and so really one of the things we want to get out of these projects is some concept of the scalability of a solution. So really, in some cases, the bigger the better. So if you can engage multiple healthcare providers, even multiple companies to deploy a multi-component solution, and something that is, perhaps even a bit larger to really show the impact, really show the scalability, I think that could be beneficial.
And in terms of the partnering forum itself, I mean, you're still looking for people to register? You still have room for people?
Oh yeah, of course. And so you'll be able to find a link to register. It's on the program webpage on our website, OCE-ontario.org. And there's a rotating banner on the landing page, Advancing Health. If you click through there, you'll find the link to register for the forum down near the bottom of the page in an important dates table. So I'll just go over some of the dates that expressions of interest are going to be due. Expressions of interest will be due on June 3rd, mm-hmm. and invitations to submit a full proposal will be due at the end of June, so June 30th, and then full proposals due August 20th, funding decisions by the end of September this year. So for those of you familiar with last year's program, the timelines are a little bit compressed this year, but certainly I think plenty of time to propose innovative projects. I'm available to support development of applications, to join meetings as well. If you're in a region outside Toronto, feel free to contact any of the OCE business development managers for assistance.
And if we're going to contact you, or would you be looking for the full team, or can individual organizations contact you?
Yeah, sure. I mean, I guess it's anyone can contact me. So if there's a person kind of leading the thinking behind the project, leading the development of the application, they can certainly reach out to me. My contact information again is on the program webpage, my email and phone number. And as I said, all of the OCE business development managers who are deployed across Ontario are available to assist.
Excellent. That's a great resource. Now, you said you have 5 projects that are going to be announced, are they going to be announced at that partnering forum or beforehand, or?
Well, so I think beforehand, and for those of you who might be attending our Discovery Conference, there'll be a panel session there on the morning of April 28th. I'll be leading that panel session, and the 5 funded projects will be showcasing there on the show floor. So if you want to meet the first year projects in person, they'll be there. You can chat with them about their experience with the program, find out about what they're doing. All very innovative, great partnerships. We're quite pleased with the result of this new program so far.
Excellent. Well, that's cool. I didn't realize that they're going to be showcased on the floor, so I'd encourage everybody to get out to that event and see them. That's fantastic. And I know some of your panelists, so you're going to have a very good panel. I think that'll be
I'm looking forward to it. Yeah.
Well, Matthew, thank you for taking the time with us. We'll put some of this information up, the links and your contact information. We'll package that together with the video and put it out on social media. I'd encourage everyone in the community to register for that partnering forum. I think it's an excellent opportunity to meet partners, whether you're a clinician with an idea looking for maybe a developer, or you're an industry partner looking for a clinician to help you work through a project. I think that's an excellent opportunity, and I think it's a fantastic program.
Yeah, well, David, again, thanks so much for helping us to get the word out, and all the I encourage all the CATA members to register for the forum, look up the program information on our website, and again, I'm available by email or phone to answer any questions. So thanks very much.
Great. Thank you, Matthew. So this is Dave Farnes for CATA Alliance signing off from TechNOW. Thank you.
Thanks.